Hey guys, so today we're going to talk about anxiety disorders. It's a really important topic in mental health, especially because 10% of all people were diagnosed with an anxiety disorder within the last year, and 30% of all people will be diagnosed with an anxiety disorder at some point in their lifetime. So, we will cover what defines anxiety disorders, the differences between generalized anxiety disorder and social anxiety disorder, and why it is crucial to use specifiers and modifiers in our diagnoses. I'll also mention a couple of the videos I watched along the way. So, here we go. First off, anxiety disorders are characterized by excessive fear or anxiety that can really disrupt our daily lives. So you have acute anxiety, which is immediate, and you have chronic anxiety, which is less immediate, but can still be highly distressing. So the mnemonic for acute anxiety is students fear C's. So with acute anxiety, you can have sweating, trembling, unsteadiness or dizziness, dissociation, elevated heart rate, nausea, tingling, or shortness of breath, fear of dying, losing control, or going crazy, and then chest pain, chills, or choking. And then all of those are present during a panic attack or can be present. And then with chronic anxiety, the mnemonic is miserable. And that's muscle tension, irritability, sleep difficulty, low energy, restlessness, and or poor attention. So now let's break down the differences between generalized anxiety disorder and social anxiety disorder. So general anxiety disorder is all about that constant feeling of worry about multiple aspects of your life. So like work, health, relationships, and it can last at least 6 months. People with generalized anxiety disorder often feel overwhelmed and struggle to control their anxiety. So on the other side, you have social anxiety disorder, and this is more focused in social situations. So those with social anxiety disorder worry intensely about being judged or embarrassed, which can lead to avoiding social interactions altogether. It's really interesting to see how these disorders differ and how they affect people in unique ways. If you're looking for a way to remember these differences, the video Anxiety Disorders Mnemonics is super helpful. And that's where I got the Students Fear C's and the Miserable Mnemonics. So let's talk about the importance of the DSM-5TR in diagnosing these disorders. This manual gives clear diagnostic criteria, which is essential for all clinicians, including us as future counselors. It outlines symptoms, prevalence, and other important factors that help in making an accurate diagnosis. Using this structured approach ensures that we are capturing everything necessary to understand a person's experiences. Now, why are specifiers and modifiers important? Well, they add context to the diagnosis. So, for example, someone with social anxiety disorder, we might specify performance only if their anxiety is mainly about public speaking or speaking in front of other people. This level of detail will help ensure that we can tailor their treatment to fit the individual's unique situation. So really, understanding the key factors that define anxiety disorders, knowing the difference between generalized anxiety and social anxiety disorder, and recognizing the importance of specifiers and modifiers are all crucial to an effective diagnosis and treatment. And I highly encourage you to check out the videos, the Stanford video on anxiety treatment options, and the anxiety disorder mnemonics video for more insights. Um,